Well, March is Colorectal Cancer Awareness Month, and we're welcoming Dr. Patrick Szeto from CHI St. Vincent to talk about improvements to any surgeries needed. Welcome to the show. Thanks for coming.
Thank you for having me.
Doc, I guess the first question is, how has the surgery for colorectal issues evolved as technology has improved?
Well, over the years, definitely we've developed more minimal invasive surgeries, and which has helped patients get out of the hospital recovery quicker.
And that's got to be one of the goals in this. I mean, we want to catch this thing early, but we also want to get you back up on your feet.
Absolutely.
So tell us a little bit about why it's important for individuals to get screened for colorectal cancer.
Well, definitely, the recommendation is that they get a colonoscopy at 50 years old. Definitely, if you have a family history, you should get it earlier. But by detecting early polyps and early stages of cancer, we can remove them and treat it appropriately.
So what are you looking for when you see these polyps or anything? I mean, what are you detecting there?
Well, basically, we do a colonoscopy, and then you go through the colon, and if you see a mass that's something that's removable, we can remove it there. However, if it's larger, then we'll biopsy it, and then we'll send it for pathology.
Has technology played a part in this part of medicine?
Absolutely, yeah, because as the technology improved, there's some polyps that in the past that we couldn't remove. Now with the new technology, we can somewhat remove them.
Is this something that's prevalent here in Arkansas?
Yes.
How so?
It's very high because we do have, unfortunately, diabetes, obesity, and different nationalities will put a higher risk for this.
So I'm not quite to that 50-year-old mark yet, but are there things that I can start early in my life to maybe prevent colon cancer in my future?
Well, they say looking at some of the symptoms, if you develop any kind of rectal bleeding, definitely being a high fiber, being on a good healthy diet, avoid smoking, having good calcium intake, those are things that can limit the risk of polyps.
One thing when you talk about this, especially for men, we get scared about it. We get nervous about it. Why do you think that it's there? Is it just that cancer word, or is it how you got to look?
Yeah, I mean, cancer is definitely frightening for everybody. But, getting a colonoscopy, everybody hates the prep.
Yeah,
but I think it's something that you have to do. Is a good awareness, just to know, because if you get a good colonoscopy at 50 and you're cleaned out, there's no polyps, and you're good for 10 years.
Oh, perfect. Doc, thank you so much. We appreciate you coming by, spreading a little bit of awareness.